Kwadcast Nation, I am bringing back the one and only Dr. Jason Fung. I have lost track of how many times he's authored books here, but he's means a lot in my world because of how much he's changed my perspective when it came to nutrition, when it came to the impact our patients have to be able to take agency in their own health, reversing metabolic syndrome. It started with his content for me. So whenever I get Jason on the show, to me, this is huge. So Dr. Jason Fung, welcome back, my friend.
Thanks so much. Thanks so much, Kwadcast. Good to see you.
Good to see you too. You've been busy, my friend. You are just came out with the Hunger Code, which has been a fantastic read. In so many words, what is this book offering? What motivated you to write the Hunger Code?
Well, it was sort of a takeoff from the Obesity Code. So the Obesity Code was really sort of talking about how weight gain, which causes type 2 diabetes, which leads to metabolic syndrome and a lot of bad problems like heart disease and strokes and kidney disease and all kinds of bad issues, right? So it's sort of the root cause. And I think my impetus to write that was that we had been taught as physicians to that it's all calories, 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 but it's not actually. The body doesn't run on calories, it runs on hormones, and that's what tells our body what to do. And so the obesity code was really talking about how the insulin particularly, but the hormones really drive weight gain, and the calories are the result of the whole gaining weight rather than the cause of it. But it wasn't actually complete, and I started to realize this as we were just working with a lot of people, because for a lot of people, it wasn't that you know, it wasn't the hunger that was driving it wasn't the sort of hormones themselves that were just driving the overeating. There's a lot of emotional component and a social component to it, which is actually quite important. So as I started to sort of look into this further, it sort of went into the sort of other aspects. Because if you think about it from a very simplistic standpoint, if you think about the problem of overeating, you say, okay, well, if you're overeating and that's what causes weight gain, okay, fine. Um, well, why are you eating, right? And you eat because you're hungry, and you stop eating when you're full. But what you quickly realize is that if that's all there was to it, our body should be very finely attuned, and therefore, you eat, you stop eating, you get full, you stop eating, and therefore you should maintain a good weight. And that was true for many, many years, right? Up until the sort of 70s. But something sort of went off. And so it wasn't simply this homeostasis that was off. That's one of the things we talk about, homeostasis, which is this fancy word for balance, right? The body always tries to balance. It was that people also had not just this physical hunger, but also sort of an emotional hunger. And the idea is that when you eat, it's not simply for sustenance, right? We try to pretend like the only reason we're eating is because we need nutrition. No, that's not even close. There's lots of different reasons people eat. One of them is to feel better. So there's a whole emotional component to it. So there's all these emotional eaters. There's comfort eaters. So you have foods like comfort foods, for example, and you eat them not because you're physically hungry, but because they make you feel better, right? So you break up with your girlfriend, boyfriend, you eat a tub of ice cream, right? You're not actually hungry in the physical sense, but you're eating because you have this sort of emotional upset, and eating because it's pleasurable satisfies this, right? And in some cases, it can actually be the dominant sort of reason why people are overeating, but it's not a physical thing, right? And then there's a whole social component to it too, because and so for example, I remember a few times where I was actually not that hungry, but because I was going out for dinner, I ate, right? And it's like I could have happily not eaten because I was sort of full already and stuff. But because I was going out, I went to a restaurant, nice restaurants, but then I had a full meal eating, and then you finally just, you just sort of get in the habit, you sort of finish your dinner. It's like, that's odd because I actually didn't need it from a physical standpoint, but because of the social situation, this is what happened. So I sort of break that down into sort of three big types of hunger. So you have the homeostatic hunger, which is driven by the hormones, and that's what the obesity code was about. You have this emotional hunger, which is when you look into the literature, it's actually called hedonic hunger. And then there's a social hunger, which is, again, if you look in the literature, it's called conditioned hunger. And all three of these can drive the problem with eating. So if your problem is that you're an emotional eater, then you have to address the emotions. Your problem is that you're a social eater, then you have to drive that social condition, right? Rather than looking at it just from a purely hormonal standpoint, which is the homeostatic hunger, which is that sort of physical hunger. So it sort of gets into this sort of deeper understanding of eating behavior, which drives us, because for a lot of people, and I was talking to some of the people. So at the fasting method, we work with a lot of people. And so I was talking to the head of the coaching program.